Mr. Braley for questions. We'll wait for Mr. Green to get settled there.
Thank you, Mr. Chairman. I began my opening remarks by talking about the fact that I'm not a Democrat who limits my conversation to health insurance reform, because I believe that health insurance reform is a key part of comprehensive health care reform. And I'm so glad the three of you are here today, because you help put a human face on what's wrong with health care and health insurance delivery in this country right now. I did 17 town hall meetings back in my district last summer, and what I learned is that people who oppose health care reform, and especially the health care reform we've been talking about, really don't want to talk about the human face of health care. So I want to spend a few moments talking to you about that. One of the people who came up to me in my last town hall meeting ripped the House health care bill and then said, after the meeting, "Congressman, I need your help." I said, "What can I do?" He said, "My brother was just diagnosed with non-Hodgkin's lymphoma, and he lives in the northern part of your district. The closest place for him to get treatment is at the Mayo Clinic in Rochester, Minnesota. But he can't get treatment there because they're not in his insurance plan's provider network." Another young woman interviewed me during the health care debate, who was a classmate of my two sons, sat down to interview me, and the first thing I noticed about her was she had a cleft palate. And during her interview, she told me that she was so excited because her parents had almost saved up enough money for her last surgery. And I looked at her and I said, "Isn't that covered by your insurance policy?" And she said, "No. It's defined as cosmetic surgery under my plan." So a woman 21 years old, born with a birth defect, just like cystic fibrosis or cerebral palsy, which are covered under health care policies, has gone 21 years with a birth defect that limits her ability to eat, to talk, and most importantly, her self-esteem. The last one I want to talk about is my nephew's son, Tucker Wright, who I've talked about before in these hearings. Tucker was 18 months old when he was diagnosed with liver cancer, had 2/3 of his liver removed, has had enormous medical costs, and thank God he's still alive. But he will almost certainly reach his lifetime cap under his private health policy by the time he's 18. He will almost certainly have another bout of cancer before he turns 18. His parents are doing fundraisers to cover their uninsured medical costs. Both of them work full-time and have good health insurance. And yet if his parents want to change jobs, they would not be able to because of the exclusion for pre-existing conditions. All three of you have lived this in your own lives. So I want to ask you, Ms. Meister, you have chronic asthma. You talked about that. If you opted to terminate your policy with Anthem and purchase an individual insurance policy to get a more reasonable deductible or premium, you would have to go additional medical underwriting, correct?
I would imagine so, yeah.
Right, because that's the way this works. And given your chronic asthma, do you think that that would be a problem for you in getting additional coverage?
I mean, personally, I work out every day. I live a very healthy life, so I don't. But on paper, that's a different story.
You have to fill out the same questionnaire.
Like you're talking to me.
Yes, and Ms. Hendrickson, you talked about your son's problem with the condition with a hole in his heart. When you fill out any application for underwriting purposes, you're required to go through your family's health history, and that would appear.
Yes.
And does that concern you?
Oh, completely.
Mr. Arnold, you were the one who concluded your compelling remarks with a smackdown to all of us about doing what's right. And you also have been affected by this, because these are the types of things that make it frustrating for people to get private insurance, because this can be so daunting. Is the experience that you've had consistent with what the other witnesses and some of the people we've been talking about face every day in trying to get health care coverage?
Absolutely so, yes. Yes. I won't repeat everything that they just said, but what Ms. Meister just said about being underwritten again and a pre-existing condition either not being covered or causing the base rate on that policy to be marked up by, my insurance agent told me, 20 to 100% because of that condition. These are the kinds of things that can happen.
Mr. Chairman, health insurance is supposed to help us when we're sick, not punish us for requiring medical care. And I think what we've heard today reinforces the need to get health reform done now. We as a country cannot afford to wait any longer. Passing meaningful health care legislation that eliminates disqualification based on pre-existing conditions is absolutely essential so that every American can have access to quality, comprehensive health insurance. And I yield back.